Hi guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, clinical geriatric clinical specialist, and CEO and founder of Physiogen PT and Wellness. So tonight for our Thanks God It's Thursday, another innovator and physical therapist for tonight. So every Thanks God It's Thursday, we have an opportunity to know more about our colleagues. They are innovators, we have entrepreneurs, even academicians, and lots of therapists. They can be physical therapists, even we have a nurse, So this is an amazing opportunity to learn more about our colleagues. And this Thanks God It's Thursday podcast is sponsored by Hello Note. Hello Note, as physical therapists, occupational therapists, and speech, they are an EMR provider, and they provide billing, telehealth, and these are amazing. So check out with Hello Note. And the Geriatric Rehab Summit, they're one of the sponsors. So thank you, Hello Note. And thank you so much again, coming back with our guest for tonight. We have Suzanne Wiesenberg. We can call her Sue, and Sue is amazing. She has 34 years of home health experience as a physical therapist. Just like me, I'm a home health physical therapist. We work together. She is our clinical director, manager, and supervisor, and she will tell more about what's are her responsibilities before. Sue is amazing. Why? Because she has a unique personality, and we will learn more at the end of this interview. And she's the one of the House of Delegates from Delaware, and she is from Lewes, Delaware, and also in West Grove, Pennsylvania. Am I right, Sue?
Yes, that's
yes.
right. Yep.
Yes. And she's
Traveling back and forth right now.
Back and forth from Lewes, Delaware to PA.
and everywhere in between. Yeah.
And that's where she worked as the senior care aging life care professional. She is the CEO and founder of her company, Senior Care Management Partners LLC. And we will learn more what does an aging life care professional does. All right. So without further ado, we have Sue Wiesenberg. Hello, Sue. Thank you so much.
Hello. Thanks so much for having me.
You're welcome. So thank you so much. It's been a while. I'm so happy and grateful that we're able to meet in Facebook again. And then, so tell us more. What does the aging life care professional does, Sue?
So this is the new term over the past couple of years for a career that maybe you've heard called geriatric care manager. So now the new term is aging life care professional. And I guess the easiest way to describe is a consultant that advocates for geriatric clients and their families, very involved in the life of geriatric individuals, supporting not only them, but also their families navigating the healthcare system. And our roles vary from day to day. It's very similar to the variety that you get in home health, which I did for many years, and that every day is different. You're always in a different environment, a lot of the times doing research, either on the phone or through the computer, through different healthcare systems, to get to know the professionals that the client you're working with may need. Connecting physicians to speak with one another and other healthcare professionals to be able to share the information they have about a particular client that may be going through challenges that nobody's been able to solve yet. A lot of times it's just the unknown. The client may not know enough about, healthcare networks. They may not have any healthcare professionals as friends or family members. Some that I work with don't have any family and very few friends, as you know, they're aging. So unfortunately, a lot of their friends are not around anymore. And I receive my referrals through the Aging Life Care Association that I'm a professional member in, and through word of mouth, through a local physician that heard about me. But I even get calls from families out on the West Coast that can't live here on the East Coast, and their loved one lives in either Delaware or Pennsylvania. I only work in Delaware, and then Southern Chester County and Delaware County in Pennsylvania. And they asked me to really step into their shoes and help them to figure out what's going on. So there is There's assessment, but it's not just the specific physical and related assessment that you may do as a PT as a part of a larger team. It's a little bit of everything. So for those of you that are in home health and perform the OASIS, it's a little bit from each system in there, but also then being that advocate for the social system for the client and actually making the phone calls, connecting the people, attending case conferences where maybe in facilities, it may be virtually with family members from all over. I've organized case conferences between physicians virtually and my client that's in assisted living. I have also one in long-term care or from the home where somebody's not able to get to see the specialist that they need. And I find somebody that's willing to look at the medical record and then input for us virtually. I do everything from medication reminders on my own to finding home health agencies, to finding solo practitioners, maybe nurses that specialize in wound care, registered dietitians that are willing to work with me. So whatever the client needs, I help them to fulfill in the healthcare world.
Wow, that's really amazing. That's why you said you are an advocate for those people. That's really,
Absolutely.
yeah, that's really amazing. And I love the environment, that you're not only helping the client itself, but the whole family because they're
Absolutely.
really overwhelmed, they really don't know what kind of resources and how can we contact this doctor. The transportation, it's like a social welfare, like MSW, and mixed with.
Absolutely.
How did you train with this, or is there specific certification we need to try
Yeah.
and enroll?
So aging life care professionals can come from a variety of backgrounds. We have nurses, social workers, PT, OT, speech therapists. And you have to apply to the Aging Life Care Association. So you have to have the experience in your background that would signify that you have worked in care management before in detail. So it does seem like there are a lot of home health professionals that apply to become a professional member. And then we can sit for the care manager certification, which I'm planning to take in March. So there's a couple of textbooks that you read, and there's tests that you can take for practice. We have mentors through the Aging Life Care Association that we can reach out to. There's meetings that we can attend to be able to learn more. We have quite a nice network of people that we're constantly communicating during the day, all from the United States. I'm not sure if we have any international. I have to find that out. But anyway, all communicating together actually, there is somebody from Canada, I know for sure, to be able to help each other with resources. So questions about what would you do in this situation? What would you do, in this type? And yeah, we support each other.
It's like a case exam, All right, all right. So that's really amazing. Thank you so much, Sue, for sharing that. You are 34 years as a physical therapist, home health, skilled nursing, acute care. That's really awesome. And now you are more on senior care management. And how about your transition? You are also our House of Delegates in Delaware, and I'm from Delaware, guys. So thank you so much for your service. You have wonderful meeting and conference recently in APTA Centennial. So tell us more. How does it work? What is a House of Delegates responsibilities?
Sure.
Do?
Absolutely.
Congratulations as well.
Oh, thank you. Thank you. Yeah, I just started in January as one of the delegates. There's a chief delegate, Lynn Sturgill, and then myself as a delegate. So we just have 2 delegates for the state of Delaware. We represent the therapists, the physical therapists that belong to the APTA, the American Physical Therapy Association, in the state of Delaware. Each state has delegates, and the number of delegates each state has, it depends on the number of APTA members in that state. So, and you have to have a minimum of 2. So even though Delaware is small, We at least have that too. And then we represent the whole body. So any of you that are listening, PTs, PTAs, that if you have any idea about how you feel we could better represent the profession, there's something going on that you want to talk to me about that you think maybe we could improve through a motion that would then become part of our regulatory body for APTA, actually, that APTA could support, we could actually develop a motion and then we can vote on it when we go to the House of Delegates every year, which Jenny just said just happened. And so there's different states, anybody can come up with a motion. There's a lot of research that goes into that. And then we try to get people to support the motion. And then we actually debate on the House floor when we get in together in person. And we vote to decide, okay, is this motion going to pass? So just like Congress. So it is very inspiring. You get to learn about challenges that maybe your state isn't having, maybe your part of the country isn't having, but other parts are. And I've learned a lot in just a few short months. So I'm feeling very honored to represent Delaware. And I would like to be able to get more input from members. So I welcome anybody that's watching from Delaware to get in contact with me.
Yeah, how can they be to participate, how can they participate as an APTA Delaware member, and how they can contact you if they want just to inform, this is what we would like to focus on. I hope you can hear, this is our concern. So do you have a specific, like the APTA Delaware has a specific membership emails, we know that we received some of those newsletter, right? And
yes,
then,
yes.
so
And replying, and reply, usually there's a link inside the newsletter that says, please contact us if you're interested in whatever it is that they're talking about there, or you can reply to the email. But my email will also be posted here, right, Jenny?
Yes, exactly.
And that's what I'm for, is to be able to reach out to me, to have me contact you and say, okay, let me ask you more about this. And then I'll bring the concern to the board and talk to the chief delegate. We were just saying that we really would love to be able to represent with our own motion next year, or, over this next year. We're taking any ideas right now, because it takes months to be able to develop the motion. As it gets closer to the House of Delegates in person, we actually exchange a lot of thoughts with the other states too, in an open hub. It's an open hub for the House of Delegates that you can come into and then get support, have debate. But a lot of it does happen on the House floor once you have this motion. So it's a very busy couple of days when we get together.
Yeah, so we have the PTinMotion at Comcast.net. So that's the one we have. All right, okay.
Yep.
So I just want to be sure if you want it separate for the Delaware or separately if you have a question. So
I use one email, keep it simple.
Yes, exactly. Yeah.
Yes, PTinMotion at Comcast.net. Yep.
Exactly. Yes, that was we have here. So that's really you shared already a little bit of your challenges there, right? So how about your wins as a physical therapist? What do you remember as a physical therapist that you want to share, especially with our balance and fall support group? What are the tips that you want to share, especially for the September Fall Prevention Month? So as a physical therapist head, you have different hats,
I do. Well, and I'm always thinking as a physical therapist. I mean, I had one client today that lived in a multiple floor home. And so I always go back to safety first, of course. And, we know if people feel safe and secure, they're also going to be happier, right? So it really affects their whole person. But I did think about this a little bit, because Jenny gave me a little input into what she may ask me. And I think my perspective for falls and balance is actually a little more holistic than, you may learn immediately in school. And you don't, obviously you have your objective testing, and we have to rely on that and the standardized tests. But I also encourage you to never leave your clinical reasoning, your critical thinking, using your clinical reasoning to take a look at the whole picture. So the tests are very important. It helps you to get specific where there may be needs, right? And to prevent falls, you would be able to figure out some of the training techniques that you want to use. But never forget to look at the whole picture, including the emotional reactions to rooms, to people that are around, maybe fears from previous falls, fears from being in certain environments, reasons why somebody may not be taking your advice when you're trying to communicate with them, what's going on. And the easier stuff is low vision. Probably sounds funny, I'm saying that's easier, but for me, thinking about those objective kind of concrete analysis that you can do fairly easily, testing the vision, testing the hearing, testing the balance test, that's the easy stuff, right? Because it's objective tests. You have to put it all together with trying to put yourself in that person's shoes. Home programs are very, very important because we're not usually with that client every day. So in between, if it's even just one day in between, 3, 4, and everybody says, yeah, but maybe my client doesn't want to do the home program, right? Make sure that you're starting at the person's level. So wherever they are physically, cognitively, emotionally, start somewhere where they're going to work with you, where they're going to agree to start. Make sure there's a log. So I always used to tell my patients, I want to know why you don't do your program if you don't do it on a certain day. So here's this calendar. I would bring in something that I made, and one section of it was, tell me about any challenges. And I had them write it down on any days where things are more difficult. So I would know, well, they were not, as energetic that day because maybe there was a stressor that they were having that day, and they may not remember it by the next time I came back. So I would have them write down, and then we would talk about, well, how could they have navigated even with the stressor of the day? How could they have just pushed on to try to do a little something? Another tip would be, I would give easy, moderate, and very difficult exercises, right? So if they were having a bad day, they at least could do something maybe in sitting as compared to something standing, or they could do something more static as compared to dynamic. So that even, including for your chemotherapy clients that may be having a physically, bad day, MS clients that, fluctuate. So having a variety of things that could be chosen from, they get to make a choice too, telling them why they need to challenge themselves, here and there, you need to add in the harder exercises, but getting them to open up to you to try to prevent not telling you the whole story. Let them know it's okay to talk about their challenges and to tell you why they didn't want to do their exercises, and then try to get to know them well enough to be able to help them solve that.
Wow. That's a lot of tips there, and that's amazing. Yes. We have a conference this coming end of this weekend, and that's some of the topics that we were going to discuss: the fall prevention, falls management, and you just hit it right there because vision, and also it's a team effort, guys. So you will always check, and I believe you're a certified dementia practitioner as well.
Yes.
I see
Yeah.
how you talk, and also how you're going to explain to them the log and everything. You're doing using visual and verbal cues to them. So that's awesome. That's a lot of tips there, guys. So if you're writing a piece of paper, check it out, and then you see how she work holistically, not only physically. And she's trying to check first what's the problem of the client and the family member. And that's where you're going to check. Physical therapist goes to the house not only to treat exactly what's the problem, but like physically, I have pain, but overall, we see what's the problem. Is it like house that needs to be fixed and modify, assistive device, things like that. And
Mhm.
that's really good. We talk about, Sue, thank you so much for those tips. We talk about how unique you are. You have lots of things that going on. You're an entrepreneur, you are House of Delegates, physical therapist, now an aging life practitioner and professional. So, what are the unique things? What is the unique about you that you want to share with us? Because me myself was surprised today.
Yeah.
Listening that. That's
Yeah,
amazing.
that was something else that Jenny had kind of asked me earlier, was something unique. And I don't really like to talk about myself because everybody is so much more interesting than me to myself, right? But when I thought about it, I said, well, what's unique? I said, well, I can talk about how I actually grew up with a disability. And I think that it definitely did shape the career choice that I made. And so I was born with congenital defects, missing my fibula, a shorter tibia, a bowed tibia, and shorter femur, and then only 4 toes. And for the first 4 years of my life, walking, I was wearing a double upright brace and a shoe lift to try to level out the leg length discrepancy. And I really couldn't walk too much at all without it on. And so through my parents talking with the physicians that I was working with and the therapists and the counselors, and they talked to them about the leg length discrepancy was going to get greater, at least a foot difference by the time I was done growing. And, with luckily, the tibia is a weight bearing bone, but because it was bowed, it was still a bit of a challenge. So they asked him, do you want to amputate or do you want to have her continue on with the double upright brace? And they did, after speaking with other parents of children that had gone through the same thing, chose the amputation. And I think it was the best choice that they could have made. And I've been blessed with being able to handle it. So at first I was going into child psychology for that reason, took a lot of psychology and sociology classes, then decided that I wanted more concrete hands-on and moved into PT. So, there's people that have been through a lot more than that. This is just a small little physical challenge that I've had over the years, but I think it has helped to be able to know a little bit more about what it feels like to, have a mobility challenge. Mhm.
Yeah, that's really amazing. Imagine you're giving hope to other people that even with their disability, because you're so functional. Imagine
Thank
as a
you.
physical therapist, it's so physical, but you're on
Mm,
that field. That's what
yeah.
I was surprised. It's so physical, but you're able to do that. And now you're on managerial side, and then now it's very difficult to do those like traveling, and also you're able to drive because that home health is driving, guys. So let's give us like that, even you have a certain disability, if you have a goal, you go for it.
That's right.
and
Mhm.
and you
There's a
just
lot of workarounds, and that's what we're all
yeah.
for, right? There's so many of us hopefully listening. We all support each other and we're helping professionals, no matter
Mhm.
what background we have. That's what we're here for in life, right? To help
You're
others.
giving hope like, oh, I cannot be a physical therapist because I have the amputation like this. I have or fracture like this. How much more? But
Mhm.
their technology give us like the edge for us to reach our dreams
Mhm.
because it's available. And thank you so much for sharing that,
Oh,
Sue, for
you're
us,
welcome.
because I'm sure there are people listening right now that will be able to give hope and also inspire from your story.
I hope so.
Thank you
Yep.
so much, Sue. And also, last thing, we just want to give you the floor to check with them if you want to say anything, last words, and also some reminders. We already gave them your email to
Mhm.
contact you. So,
Mhm.
any other things you want to tell us to our listeners?
Sure. I love collaborating. So if you have thought of any questions that you may have for somebody who's been doing this for many years, even about navigating your career and all the different options, because I've looked into everything, tried a little bit of everything, even though home health has always been my focus, outpatient, I worked in pediatrics for a little while, almost forgot that, in the school system, skilled nursing facility, long-term care. Those were all more like secondary jobs for me. I was always, mainly home health and a little hospice too. So if you're interested in hospice, I can talk to you about that. And obviously amputees. So if you just have any questions or any support you need, I love working with challenging patients, clients. I call them clients. Now I call my clients my partners, which is why my company is called Senior Care Management Partners. There's only me. So it's not that I have a colleague, it's that the people that I take on as clients are my partners. We work together, myself, the client, the family, as a partnership to try to improve the well-being of everyone. So if you have any challenging situations and you just want a consultant, for a little while, an hour or a couple of either phone or virtual, in person, whatever you need, just let me know. And now I guess I'm getting up into the older generation soon, so I can impart any knowledge you want to pick my brain for. I'd be more than happy to talk.
All right. Thank you so much. Yes, I'm sure we have lots of people that needs your services, aging life care professional. That's really amazing. We have lots of geriatrics, aging and older adult. Even aging adults have their own needs,
Mhm.
and also the older adults with families being overwhelmed with different things that they need some resources. And thank you so much for all you do, Sue.
You're
So guys,
welcome. Thank
yeah,
you.
so guys, you can contact Sue in PTinMotion at Comcast.net if you have any questions, or if you are in Lewes, Delaware, in PA, she can be contacted. Check out how she can be reached, and we appreciate you guys. All right. So it's me again, Dr.
Thank
Jenny
you.
Yusuf. Thank you so much, Sue. And this is another episode of our Thanks God It's Thursday for the Balance and Fall Support Group. If you have any questions, feel free to contact us, join our group, and we can direct you to our colleagues and to our experts, and I hope we help. All right. Have a good day. God bless.
Bye-bye. Nice talking.
Thank
Bless you
you.
too.
Bless you guys. Bye bye.